Okay. Well, good afternoon. I'm Barbara Amstutz, president of the LWV of Central Delaware County. Welcome to the County League's virtual hot topic discussion with Rosemarie Halt. All of us hope you and your family are staying healthy and safe during these challenging times. The League of Women Voters is a nonpartisan civic organization. We neither support nor oppose candidates. We hope to inform you about issues facing your community, present different points of view, and provide you the resources to help you make thoughtful choices. The League's mission is to encourage knowledgeable and active participation in government, to increase understanding about important legislative and judicial issues, and to influence public policy through education and advocacy. Before Rosemarie speaks, I want to update you on a few League matters. Vote 411 has everything you need to know about the primary election during COVID-19. In Pennsylvania, the primary election date has been moved to June 2nd. Your completed mail-in ballot application must be received by May 26th. All voters are encouraged to register to vote by mail as soon as possible to ensure a mail ballot is delivered. In-person polling locations will still be open. However, some may have consolidated, so please check polling locations on the Delaware County website. We are currently doing everything we can to adapt to COVID-19 while continuing our League programs. This spring, all of our events will be held on Zoom, including our 2020 annual meeting. Here we will elect a new slate of officers and board members, approve changes to the bylaws, and confirm local program priorities. If you are a member, please register under events on LWV-CDC.org. All registrants will receive a PDF of the annual meeting booklet prior to the video conference. On June 5th, Roberta Winters, president of the Radnor League, will be our speaker for a hot topic discussion on pipelines and environmental issues close to home. Roberta has been working on sustainability and environmental justice for decades. She will report to us about what is currently happening in Delaware County and how to become more involved. Please register for this talk on our website. Before we start the program, I have muted all participants during the meeting. Many participants have provided questions. However, if you have a question, please use the chat feature on your Zoom screen and select Question Moderator. Ann Mosikowski is serving as our question moderator and will curate questions to make sure we cover as many diverse topics as possible. We will be recording this meeting, and the recording will be posted on our website for viewing on demand. We hope you will find this program interesting and educational. Jane Brennan will introduce our speaker and fellow League member, Rosemarie Halt. Jane?
Okay. Rosemarie Halt has over 30 years of experience as a healthcare professional, specializing in health policy and public health. She currently is the public health consultant for Delaware County, coordinating the COVID-19 pandemic response with Chester County Health Department. Prior to taking this new role with Delaware County, Rosemarie was the Senior Director of Policy for Maternity Care Coalition, where she advocated for the health and well-being of pregnant women and their families. As a registered pharmacist with a master's degree in public health, Rosemarie has focused her career on improving health policies in childcare and in public health systems, and she is currently actively involved in combating the opioid epidemic in Pennsylvania, as well as establishing a county health department in Delaware County. Rosemarie has extensive professional and community advocacy experience at both the local and the state level, and that includes leadership positions in several community-based organizations, such as the League of Women Voters, And Rosemarie is the current president for the University of the Sciences Alumni Board of Directors. So we welcome you, Rosemarie Halt.
All right, let's see if this works. Okay, did that work?
Yes, you're shared beautifully. We can
Okay.
see your slides.
All right, it's always good when technology cooperates. So I just wanted to begin today really kind of updating everybody on what's happening around public health in the county, particularly around Chester County Health Department being our COVID-19 response. As you may know, on March the 19th, the Pennsylvania Department of Health approved Delaware County and Chester County coordinating together on Delaware County's response. Chester County Health Department is our official and legal responsibility for COVID-19 response. So they take care of a number of things I'm going to go over. This was a very unique and pretty historic event to actually happen in our state. To my knowledge, this is the first time that this kind of relationship was established. Certainly it's unusual times with the pandemic, but you know, in the long run, we hope that this relationship will prove beneficial both to both counties in the collaboration that's occurring now. And we anticipate, you know, this going on till we actually have a vaccine and we have no longer in a pandemic time period. So with that being said, I'll go to the next. This is Chester County Health Department's org chart. And the reason I wanted to show you is just that there's, while we are in pandemic response, public health does not stop right now. And there is lots of other things still trying to happen, albeit in a limited scale. And the beauty of having a health department, though, is also that all of these other departments can come in and really, these parts of the health department can come in and assist. So many people from, say, for the Bureau of Environmental Inspections are also helping to do some contact tracing and things. They're trained to also do that. So it's really interesting to see how, you know, the health department can pivot and still, you know, be with the primary job of protecting the population health in Chester County and covering both counties for COVID-19 response. The one area that we are under is really the population health, and that's the disease investigation and surveillance, public health emergency preparedness, and health education and promotion. And I'm gonna cough, but I do not have COVID because I actually got my antibody test yesterday and I'm negative, so it's just allergies. So Chester County Health Department's COVID-19 response for Delaware County includes several areas. They're doing the case investigation and contact tracing, which is really critical when you're dealing with an outbreak. The case investigation is primarily, you know, if we're for positive cases, and if all lab results that are taken in the state have to be reported to both the Pennsylvania Department of Health and the local county health department. And then they have the responsibility of following up. But you should, if you had a test, you should have been also followed up by the ordering physician for that test. But the deeper contact tracing and other information would come from the health department. So hopefully you received the call if you were positive. COVID-19 testing is occurring throughout Delaware County. The biggest parts of the testing are still in our hospitals, although that might be starting to decrease as the hospitals start to continue to try to do acute care and all the you know, elective surgeries that were backed up. So all of our major health systems, Crozer, Mainline Health, and Fitzgerald Mercy, we're all doing testing and continue to do testing. The testing is still has to have an order from the physician, but we are starting to expand community testing. Last week in the city of Chester, the Black Doctors Consortium did 376 swab testing, which is the nasal swab. And then we are going to be opening, hopefully next week, in Upper Darby, a testing site for those who have been unable to, or if don't have a physician or something, to get tested. And we're going to be rolling a mobile unit out throughout Delaware County from that point forward. The antibody testing is a little tricky right now, and you know, you probably have heard a lot of information coming out. There is basically the primary tests right now are the point of care tests that you might have heard about, which uses that you can go to the doctor's office, and it's kind of like a rapid strep if you've ever had a rapid strep. It's a rapid 15-minute test, and it kind of just gives you know, it's pretty good at giving positives. The negatives are kind of can be the iffy part in those tests. And so if people continue to have symptoms and were tested negative, they recommend doing it. The other nasal swab PCR test that we call. The antibody tests are really more for after you've had exposure to kind of know if you've had that exposure in the community. So most of the antibody tests that we prefer have an emergency use authorization. And we are hopefully at some point going to be doing wider spread antibody tests to know kind of what is the prevalence of the disease in the area, particularly in high-risk communities like long-term care facilities, which we have started doing for them. Data collection and analysis is a major part of what health departments do. And there's lots of data around the pandemic. If you've had, and I have another slide, but if you haven't seen it yet, the Chester County Health Department website has all of the data for Delaware County on their website. It includes the daily cases, positive cases, the number of deaths, the number of total negative cases, which you add the positive case and negative cases, that's our total number of tests being done. It also includes some graphs that help to show other interesting data, which we're trying to look at for the municipalities in order to try to get back to work. Right now, Delaware County would have to have no more than about 21 tests per day, positives. We are nowhere near that number. So in order to, according to the governor's guidelines, and that's just one benchmark, but we're pretty far from the benchmark of opening up. So while the number of positive cases are important, of course, the number of deaths have been really difficult in our community. And unfortunately, many of those deaths have been in our long-term care facilities. And we are working with the long-term care facilities in providing guidance. There's a special team with the health department that's working on that. And so they're providing guidance on how to make sure infectious disease protocols are being followed, how to wear personal protective equipment, for example. They are working on getting testing for both the staff and the residents of the communities. Many of our long-term care facilities in Delaware County particularly are private. They are regulated by the state. So they are in charge of the licensing and regulation. So what Chester County Health Department can do is provide guidance specifically around COVID-19. So we can't, you know, do specific things. People have called and said, you know, if they felt like their parent wasn't being taken care of. There is a separate group, COSA, from the Pennsylvania Department of Health as well, which is tracking those types of reports, but we're just strictly focused on the COVID-19. Once a week, we have a long-term care call just to help the long-term care facilities answer questions. We also work with them on developing strategies to ensure that, you know, the staff is maintaining their health and mental health, and providing whatever resources they ask for. If they require, you know, anything such as test kits or personal protective equipment, that is filled by Delaware County Emergency Services. Public health and communication is a huge part, especially in a pandemic. So right from the beginning, one of the first things that was done was Delaware County was able to utilize Chester County's hotline. And so any resident can call that hotline and have a question answered. by a public health professional. In addition to that, the website has a wealth of information. So if you, hopefully most of the questions we have anticipated, if not, let us know. So if you have some, any kind of information, there's fact sheets on what to do for testing, how to make a mask, how to ensure that you're following the guidelines and the latest from the Pennsylvania Department of Health and the Centers for Disease Control, as well as other links to resources in the community that could be helpful, such as food banks. Support and guidance, as I said, for the long-term care facilities, but we're also supporting the hospitals. You know, the hospitals, of course, during this time have had a difficult balance between being having, you know, large numbers of pretty sick patients, but then they're also not doing their regular, you know, work. And so, like, as I mentioned, things like acute care, elective surgeries have not been happening. And so now we're hoping that those will start to return to normal and be able to at least ensure that people's are not suffering from other health care needs. Interestingly enough, as you might have heard in the news, the emergency room visits are significantly down, but those who are going are much sicker. So people are waiting a long time to go to the emergency room because they are afraid of COVID. I can assure you that now, you know, the hospitals have been really good about doing the infectious disease protocols and establishing, you know, all kinds of information for their staff and for the clients. Visitors are still prohibited, but they are really working towards ensuring the safety of everyone. I think you will see that you hopefully will be able to go back and have a regular doctor's appointment pretty soon for those of you who've been waiting. And so I hope everybody gets the care that they need soon. And then the other major group that we are really helping is first responders. And, you know, as you can imagine, the first responders, particularly the EMTs, are really on the front line of this. And so, you know, many of them initially were being exposed to COVID positive patients, particularly from the nursing home. So we've worked with them on ensuring that they have the proper equipment and to provide regular testing for them to protect them, their families, and the community. Okay, so one of the things that has made this job particularly difficult and frustrating right now is what I call the pressure points. And while you may have heard this from the beginning in, you know, the lack of these items like the testing kits and personal protective equipment, it really, really had an impact on what we were able to do from the get-go. And unfortunately, if we had had enough testing kits, we could have maintained these current things to outbreaks that could have been contact trace, and people could have been quarantined, and we could have been able to prevent large-scale infection in the community. We feel that probably there was infections in the area sometime in late January, even though it took till March to really have the testing and things available for us to detect that. And unfortunately, the lack of testing kits make it difficult for us to be able to, you know, address the long-term care issues, particularly, which, you know, if we could have gotten into those facilities early and really cohorted and quarantined more people and had regular testing for staff, we could have probably significantly reduced the number of outbreaks in those facilities and deaths as a result. The personal protective equipment goes hand in hand with the testing kits. And so the personal protective equipment protects the staff and protects the patient. And without proper personal protective equipment, you know, it's another way for the virus to be able to be widespread in these, especially in hospitals and long-term cares. The personal protective equipment is still an issue. I had to laugh because I think somebody on from the federal level said that by the fall, that nursing homes and hospitals should have a 90-day supply of personal protective equipment. And our biggest goal is to keep the hospitals at a 5-day supply right now. So you know, I think there's a huge disconnect in what have been able to receive from the federal government as far as testing kits and personal protective equipment. The supply chains are really stretched. We have hospitals competing against each other buying this stuff. We have counties competing against each other. We have state governments. It really should have been a much more coordinated supply chain from the federal government. And I hope that the League of Women Voters will take this up as an advocacy issue, because if we don't get this figured out by the fall and we have a second wave, could be really, really, terrible. It's the best way I can say it. So, as we go forward, this is one of the things that I'm really tracking is the availability of these critical supplies and how our healthcare system is able to continuously meet surges. I do want to compliment everybody that, thank you for flattening the curve, for staying home and doing your part. That really did work. The fact that most of the cases we have now are in the long-term care facilities means that it's not good for the long-term care facilities, but means the general public has been doing their part and, keeping themselves safe and keeping the spread of the disease. So just as I mentioned, this is the Chester County, just a quick view of what some of the things that are on their website. Really important was from the beginning, particularly in Delaware County, we have such a diversity of residents here. And if those of you know, particularly in Upper Darby, where there's 67 different languages spoken in the high school, that we thought it was important to at least translate as critical material for the top 6 languages identified. And so that was something we did right away. It's on our website. We also have given it to the communities in Upper Darby, to the different community groups, to the different grocery stores, whoever needed it. It has been a widespread distribution. We also have information about what to do for social distancing, things to do at home, testing information if you have questions about that. And then in addition to all the things that are available on the website, if you do have a question, you can certainly call the hotline and they will try to direct you to the resources that you need. We created on our dashboard some really updated, and we're constantly looking for it. So if there's something here that you don't see or you feel that would be helpful, please let me know. But one thing that we were continuously asked was the long-term care facility data. So we separated that out so people could see it. Unfortunately, as I said before, the Pennsylvania Department of Health and regulates our nursing homes and long-term care facilities. And their direction, at least for now, is for us not to release the positive cases and death data for those facilities. However, we are tracking them as an aggregate, as a group. And so we are looking towards making sure that we can provide as much information that's helpful to people. We have encouraged the individual nursing homes and long-term care facilities and congregate care to make sure that they have regular communications with the families. It must, we know how frustrating it is for families that, one, they haven't been able to see their loved one in months, and then 2, that they're hearing a lot of rumors or hearing all kinds of information. So it's the responsibility of the nursing home to make sure that they're communicating on a regular basis about what is happening in a facility, what steps they're taking, and how families can communicate. I know Zoom has been really important for some of the families. There is an effort through like Temple to go, Temple students are connecting with some of the long-term care facilities, for example, in helping to set up the laptops and things for people to communicate. So it's a great endeavor to see people coming together and really helping each other. So this is just, again, another view of some of the dashboard information. We have some great graphics and tried to just break down the information that can be useful for people and give them a sense of what's happening in their community. Part of the reason that County Council wanted to move to Chester County Health Department was that the state was just not able to give us broken out data, and so we've been able to break it out by municipality, and then also looking at it as a county as a whole, and then we're looking at age groups and gender. Unfortunately, from the beginning, when they initially started doing the test, they did not ask a lot of other demographic data. And then one of the questions I frequently get is, are minority populations getting enough testing? And so we are going back, and to the extent possible, when they are doing the case investigations, trying to collect additional demographic data to make sure that we're tracking and understanding where there could be potentials for people being missed in testing or feeling that they're not getting resources they need. So that's the end of my slideshow. And I wanted to make sure I had enough time for questions. And I think, Barbara, I'm not sure.
Yeah. Anne, do you want to start with some questions that were sent in earlier?
Several of the questions have already been covered, dealing with the health department and the COVID situation. But we do have some specifics that were not covered. So, for instance, we've gotten this question twice, actually, dealing with the current study of Johns Hopkins.
Okay.
If you could share some of the information that you might have or might not have from that study.
So we don't have the full study yet. We're expecting it at the end of June. And so I think there'll be a public meeting about that at that time. Dr. Monica Taylor from County Council is the one that's spearheading that. But we are moving forward on the health department, which is good news. One of the things that they have recently done is hired a consultant who will be helping form our Board of Health, or initially we're not going to be calling it Board of Health, but it'll be what it goes into. And they will be looking at things like what would be our strategic plan, what would be important, things that we have to examine, data, what would be the ideal structure for our health department, particularly starting out where we wouldn't be able to do, build up to a full 110 people health department. It will probably be, half the size. And then what are the critical pieces to build on that? And then at some point, and we held off on this, initially we were going to do a fiscal feasibility study, but given the economic situation right now and the changing issues in county, state, and federal funding around public health, we feel that it's would be difficult right now to analyze what would be coming into a newly formed county health department. And the fact that it'll probably take us 1.5 to 2 years to actually get approval and have it build up, that what the world could look like a year from now could be a lot different. And so I think we're going to hold off on the fiscal and just really start working on some of the basics infrastructure that we need.
Great, thank you. So to that end, is there a timeline? You sort of alluded to a little bit of a timeline, but what would be the earliest for us to have some type of a public health department in place?
Yeah, and so much is going to depend on what happens with COVID and the pandemic, and so there's a lot of unknowns. Part of what the charge of the consultant is to try to make that timeline. So that's one of the things that she'll be examining. And she's going to be working on a number of other initiatives, particularly looking at other models for health departments. There's a thing called, County Health 3.0, and that's kind of a new model of this up and coming idea of what public health should look like in the local level. Okay. So, we're anxious to see what information she has about that. So I would say 2 years.
2 years. Okay.
Hopefully. And that's with all the unknowns that we
So, but specific to you, what do you see? One of our questions was, do you see your role going forward?
So for right now, I'm going to stick to my COVID-19 very long 7-day-a-week job. And it's and if I survive this, we'll see if I want to take a sabbatical or apply for the job of somewhere, apply for a job in the health department. But right now I'm actively going to be involved in helping to form the health department. I am taking on this responsibility that I've been doing for 8 weeks. It feels like 8 years. And I am going to just kind of go with it and see where we go.
I know from prior presentations that you've done, Rosemarie, that you've talked a little bit about the funding. How do public health departments get funded? But there's a lot of people on the call who might not know that information. Could you just cover that a little bit?
So currently, public health departments are funded from a combination of funding sources. So there's primarily in Pennsylvania, there's official funding from the Pennsylvania, I guess, Department of Health that filters down to county health departments. But we have something called an Act 315 funding in Pennsylvania that is supposed to make up for about a third to a half of the funding. And that funding streams, though, have been pretty flat really for the last 8 years. So many of the health departments, in addition to that, there is federal funding that comes through for different things like maternal child health, emergency preparedness, those types of things. And so that's an additional funding sources that can make up, depending on the size of the health department and what you do in your community, is another source that is about a quarter for most of the health departments. And then there's also private grants. So many health departments, especially, could be examining or working with another institution about a particular health topic. For example, if you have a high sexually transmitted disease rate or HIV rate. So a lot of health departments do get additional funding for that. And then there is funding particularly around, health inspections, and there's additional funding through Act 12. And that's really around the environmental requirements in the health department. And that usually is something they can bill for that, as many of the municipalities do now. And then there would be the additional cost of what it costs for the county to pay into. We estimate that costs somewhere between $3 and $6 for Delaware County, based on the local county health departments in the Southeast region, which is Bucks, Montgomery, and Chester County. Philadelphia, it's its own separate thing. But those three are most similar to what Delaware County would probably be.
Okay, thank you. You did talk about the congregate care communities, especially in the nursing home facilities, but we did get a question about the prisons. And you didn't really touch on that. And I know there's another department that deals with that, but could you share some information?
Yep, so the good thing was the timing of Delaware County going with Chester County was really important, particularly with the Delaware County prison. So I think that first week that Chester County became our health department, there was an outbreak in the prison of COVID-19. I have to remember to say outbreak, because if I say it with the prison, people think that people broke out of the prison and not actually. So the good thing was that public health worked. I just use that as the example. Public health worked. They were able to go in. They helped the prison, which is a private company in Delaware County right now. They helped the prison staff and management work through how to separate the prisoners who were positive and the negatives, how to have the staff be trained and separate the staff and did some testing of the staff. So all of that happened, and we knew that the numbers initially would go up, but we were in there early enough to prevent that outbreak. And I believe we may have no new positive cases there for a couple weeks now. So it worked. And it just, unfortunately in outbreaks, it gets worse before it gets better. But in this particular case, it was encouraging to see that the policies that, we were helping them do actually had an impact. So we feel pretty comfortable with our prison in Delaware County. Of course, the juvenile detention center was another issue, but that was pretty minor. And I feel like I feel comfortable with the prisons. I feel truthfully better with the prisons than I do right now with the long-term care facilities.
Thank you. We're going to ask you to get out your crystal ball because we have questions in the chat, and we also got a question prior to one dealing with the schools. Do you have an idea about when they might open? Will they be in operation in the fall? And that sort of goes along with this whole, when do you think this lockdown might be lifted?
So there is specific parameters for all of those things. We are still in the red here in the Southeast region. And the Southeast region is going to be looked at more as a region than in the individual counties, because we're just so connected. Philadelphia, Montgomery, our borders go back and forth. It's not, and we're pretty densely populated. So I think that at some point this summer, I think economically, so if there's a public health thing and the economics of it. So, and if I put my public health hat on and I want to keep everybody safe, I would say the stay-at-home order is until we can get the positive cases down enough that we can do the efficient contact tracing. The practical side of me says that that's not a long-term solution, and that they're going to have to find a way to do a balance and figure out through risk mitigation what is the safest way to keep people safe who are at risk. And also we have to open up the economy, because there's also the other risk of people going hungry and not getting the care they need, and all those things are going to start to pile up on us. So it's a very difficult situation. I would say with the schools, I think that's going to be a statewide review. I feel like it'll be something what they're doing in France, which is like it might be like half days, or like, or one day this group comes in and the next day the other group goes in. I don't know if we could totally go back to a normal school day by this fall. But there's a lot of recognition that parents, if they're going to go back to work, are going to need the kids to have school, and the kids themselves to maintain their education and not to lose a whole year would be important. So I think, again, people are weighing, the positive and negatives of opening up and how that should happen. So again, it could be a regional decision. I know we are really looking at the data in the short term with long-term hopes, and we don't have really good way of predicting what we can do right now come September. I can tell you, my daughter's supposed to get married in October. So you can imagine my 26-year-old daughter planning a big wedding, and what we're going through. And I know many, many people have similar type things, like people want their lives to get back to normal. And we all want that. I also want to say, because I'm asked this, and people say this all the time, oh, it'll be fine once we get a vaccine. And the vaccines do look promising. There's all kinds of people saying, if you listen to to President Trump, that we might have a vaccine by the end of the year. You listen to other people and they say it could be 2 years. I think it could be somewhere in the middle. It's a virus, and viruses, as we know, are tricky things. And we know of 8, right? At least I know of 8 different types of this virus out there. And so thinking that a vaccine is going to be the thing that gets us all back to normal, it'll definitely help. But just like the flu vaccine, it which is a different type of viruses. So I don't want people to misunderstand that. But like the flu vaccine, we don't always hit it every year. And so some people will get the flu and some people won't. And it depends what you were exposed to. And, so I'm hopeful with the virus that they can find a vaccine that really can impact a significant portion of the population. But I also think of this as something that's going to be ongoing, like the flu, that now you might be getting the COVID vaccine every year with your flu vaccine. So
Thank you.
I went in the wrong direction there, but that just popped.
No, that's good. That's good.
And why don't we ask just a couple of more questions and then we'll try to close because Rosemarie needs to go a few minutes before noon.
Okay.
So how about a couple more?
All right. I'm going to ask one more related to actually the pandemic, and then there's two that weren't covered in the chat. There's a question here dealing with volunteering. When you asked about the advocacy, or you mentioned the advocacy of what we can do, one of the question is, are there any volunteer non-medical positions to help out in this situation?
Yep. So I tell people to join the Citizen Corps, PA Citizen Corps. So you can go on the Delaware County website and there's a link for the Citizen Corps, and you can just register there. There's going to be through this lots of opportunities that we'll need people for different things. It may be if we do wide scale testing, we may need people to call up and give test results, like things like that. I think there's also been calls for things. There's different groups that have been volunteering. And so they're doing things like making cards for the nursing homes. We've been collecting cards. They're also doing things like helping, if you have a technology skill, trying to connect people that don't have technology and helping them be connected to this new world where if you don't know Zoom, you're struggling. So I think there's lots of opportunities like that. And then just even if you have the ability, I know there's lots of food collection, food drives and things like that happening around. And so a lot of those things are on the Delaware County website as well.
Okay, fabulous. Thank you. There's actually a crossover question because one of the questions in the chat has to do with what other data is the Chester County collecting besides on the COVID situation for Delaware County. And it gets to a question that was submitted earlier dealing with the food situation, the Eat Safe PA. Apparently Delaware County has that up, or the Chester County has that up on theirs. And that correlates to what's on the state site. And thinking about that restaurants might start opening again, how will that be monitored and that data collected and reported?
So Chester County will not be covering that for us in Delaware County. It's still maintained by the system that we had prior to. So everything that's not COVID-19 still remained the same in Delaware County. So in Delaware County, most of the local municipalities, health director or inspector is the one that would have done the restaurant inspections. And if a municipality did not have it, it went to the Pennsylvania Department of Agriculture, and they would be the ones responsible for that food inspection and reporting. So that has been the same.
Thank you. And looking at the time, and we know you.
Thank you, Ann.
I was going to ask one more question, just real fast, that has to do with environmental. She has, that's an old problem that the league's worked on forever.
Right.
But somebody asked about environmental issues that came up a couple of times. So will the health department be, once we're out of this situation, be dealing with overall environmental issues also?
So they would do, and when we say environmental, everybody has different interpretations of that. So in health department things, they think environmental like septic systems and trash and that kind of thing. And then there's environment.
In this case, it was pipelines
and stuff. So, but they would sit on, so it's difficult. So we don't have authority except for, say, if the pipeline caused a public health issues, like a leak. then it would be something where the health department, but we wouldn't be in regulating it or saying that it could happen or not happen. It would strictly be, or we could be reviewing public health information that might be detrimental to the health of the population, but we don't get into the regulation of it.
Thank you.
Okay, and thank you so much for being a wonderful question moderator. You really curated beautifully. Thank you. And thank you, Rosemarie. So I just want to thank you so much for speaking to us today. We as CDC is very fortunate to have you as a member of our league and in a position of decision-making authority with the county. Your 30 years of experience as a healthcare professional specializing in health policy and public health has been a huge asset to our league, and we are most appreciative. We will continue to follow your coordination of the virus response with the Chester County Health Department and the new developments moving forward, and we hope you'll come back again to continue to update us. I want to, many thanks for your informative talk today, and to all our members and guests who came today, we invite you to continue to join our hot topic discussions in the future and to even consider becoming a member of LWV, because we would love to have you. So thank you all for coming today. If you have any other questions, you feel free to email them to me or to Ann Mosikowski, and we'll make sure they get to Rosemarie and we'll get back to you. So thank you again for coming, and I hope you found this program educational and informative. I'll now end the meeting.
Thanks, everybody.
Thank you all.